Good afternoon, everybody, and welcome to this meeting of the Health and Wellbeing Board, and thank you for your attendance. Can we move straight on to apologies for absence, please, Rachel?
Thank you. We have apologies from Councillor Mrs Bradwell, Councillor Mrs Bowkett, Councillor Mrs Rawlins, Councillor Gray, Kevin Lockyer and Di Bailey. We have apologies from Melanie Weatherly, and Michelle Jolly is attending in her place. We have apologies from Heather Sandy. Linda Dennett is attending in her place, and apologies from Councillor Wright, and we have Councillor Nanstead attending this afternoon.
Thank you, Rachel. If I could just explain to everybody, the councillors, unfortunately, the rain has actually now got to the point where it's starting to flood in places, and so there's several of them that have had to disappear at very short notice, so please forgive us. Thanks very much. Minutes of the meeting of the previous item number 3. I'm assuming that everybody's read these. Can we just go through them though for accuracy, and I will please shout out or put your hand up if there's anything that you wish to amend. So page 5, page 6, page 7, page 8, page 9, page 10, page 11 and page 12. Can I just all have a show of hands to agree those minutes, please? Any against? Any abstentions? Thank you. Presumably that's for absence, is it? Yeah, thanks very much. Phew. Okay, item 4, we move on to the items that were matters arising, and I believe that most of those items, if not all of them, are either on the agenda or have been updated. Including the final one, 10C, which was about the October agenda. Are you bringing that then? Thanks very much, Emma. Okay, Chairman's announcements, item 5. Rattling through this, aren't we? Again, I'm assuming that you've read everything. Just a couple of things to add to what's printed. One is to thank Councillor Bowkett and those that attended the Lincolnshire Healthy and Accessible Homes Summit, which was on the 20th of September, a very, very successful event, and just shows how important good quality homes are. The other item that isn't on here is huge congratulations to United Lincolnshire's Hospital Trust, who have now got an even longer title, because somewhere in the middle it's teaching hospital as well. That really is a milestone. It's absolutely great, and to think that we can literally now, as well as growing our own with the university, we can then take them on and train them up a bit further is a wonderful milestone. So well done to all involved there. And then the other announcement, I'm going to hand over to John for this one, is to do with the new GP provision. Thank you, John.
Thank you. Thank you, Sue. Afternoon, everybody. Perhaps just if I could just animate 1 or 2 points in the Chairman's announcements as well. Firstly, just to share with the Health and Wellbeing Board that clearly you'll have seen in the national media the DARS-I report, the investigation to the state of the NHS across the country, and there's been a lot of comment about that nationally. Just also to emphasise that's seen, I think, as a step in the progress that the government wants to make in terms of creating a 10-year plan. It's not yet been quite crystallised whether that's an NHS 10-year plan or a health 10-year plan or a little bit of the two of them. That work is now being progressed, led by Sally Warren, who was previously from the King's Fund. So the Darzai report and outcomes, I think, is seen as a sort of the platform on which that work will move forward. So I think the Health and Wellbeing Board should, we'll make sure that we bring sort of appropriate updates to you all about that. The Secretary of State has consistently said that his three really big strategic priorities are prevention, out of hospital, community, neighbourhood type working, and digital, all of which one way or the other I think the board has an interest in, obviously particularly around the prevention side of the house as well. So again, we'll keep people updated about that. Meantime, in Lincolnshire, we think we're doing much of what has already been discussed nationally. We just need to keep going with the work that we're focused on and make sure we deliver the commitments we've made in 24-25. So in terms of the collective action by general practitioners, I just wanted to sort of put that in the frame of where we are, if you like, with our general practices and PCNs as a whole. So firstly, to say that there is national governmental recognition that general practice across the country has been struggling with and continues to struggle with a bit of a sort of capacity and demand mismatch. And I think we see that happening across general practice in the county as well. Our GPs and their teams working their socks off to try to keep on top of the level of patient demand that there is. But that's not unique to us. That's a feature across the whole of the country. And alongside that, over the past couple of years, if not longer, GPs across the country have been raising concerns about the overall state of primary care in the country, and they've got specific concerns about the level of resource that's going into primary care. Interestingly, Darzai reflected on previous intentions to put more money into primary community neighbourhood type services, that's NHS money, and how we've managed to actually put the vast majority of our investment into secondary acute care. So the nation's GPs are currently undertaking collective action, which isn't a strike as such, but it is more sort of a work into contract sort of arrangement, and individual practices are making their own decisions in relation to that. Alongside that, NHS England is working with a number of ICBs, which includes Lincolnshire, there's 7 across the country, to try to understand more the capacity and demand mismatch, and to invest some money and resource and improvement resource in the short term to try to understand how we can improve matters. It's quite a prestigious programme to be involved in. 3 of our PCNs in Lincolnshire are involved in that. They all have to be in and around the city of Lincoln here. I was at the national launch event, I think it was last week or the week before, recently, and I must say it's a pleasure to be associated with it, and it was full of GPs and their teams who are full of ideas and innovations about how they want to change and develop and evolve in partnership with the rest of us going forward. And I must say, our guys from Lincolnshire, wow, we've got some really impressive people driving that work forward. So At the same time, we are dealing in Lincolnshire with some of the impacts of collective action, whilst at the same time being involved in a very prestigious and high-profile pilot with our PCNs about how we further develop and enhance what they do for our population. Thank you, Sue. Sorry for going on a bit, but thank you.
You're forgiven when you've got good news like that. That's absolutely marvellous. Thanks very much indeed. Okay, we now move on to item 6A, which is the pharmaceutical needs assessment. Now, I don't know if that's going to be Derek or if it's going to be Alison. Okay, Alison, over to you.
Thank you. As board members should be aware, the Health and Wellbeing Board has a statutory responsibility every 3 years to produce a pharmaceutical needs assessment for the area. So we last published our P&A in 2022, so we're due to publish the next P&A obviously in 2025. So really this paper is to assure the board that we have started that process and have got arrangements in place to undertake that assessment, and just ask the board to approve the timeline. So just to remind members that the P&A is a factual document. It's regulated by the pharmaceutical regulations of 2013, so it's very prescriptive in what we put in that document, so it won't necessarily cover the breadth of the work that we want to do around community pharmacies, but we are required to produce that assessment setting out the current and future needs of pharmaceutical services in the county. So we have established or re-established the steering group that's made up of representatives from the ICB, Public Health, the local pharmaceutical committee, the local medical committee, Health Watch Lincolnshire, and we've also contracted an independent pharmaceutical expert to help us to write the P&A. So that's a company called Primary Care Commissioning Community Interest Company, PCC. So it's quite a long title. So they've joined us today for our steering group meeting this morning, just to start setting out some of the more technical sides of the document that we haven't necessarily got that expertise within public health. So the timeline is set out in section 2. So we're looking to bring a draft of the P&A to the board meeting in December for the board to sign off as the draft that we go out for the statutory consultation in January. So we have to undertake a minimum of 60-day consultation on the document. So we're looking to run that from the 6th of January through to mid-March. We'll then be bringing the final P&A for approval to the board in June, so that we can then publish it. We need to publish by October, but we'd like to get it published for the midsummer next year. So really the recommendation is that just the board accepts or approves the timeline and the process that we've set out in this paper. Thank you.
Thank you, Alison. Any comments or questions from anyone on just the process at the moment? No? Okay. Can I have a show of hands then that we agree with this process? Everyone for? Anyone against? Any abstentions? Okay, thank you. It's the most riveting document in the world. Not. Thank you. Let's move on to item 7A. Now, we've had to have a quick swap round here because, as I've just mentioned, Councillor Bowkett and Councillor Gray are having problems with their geographical area at the moment and the rainfall. So Derek is going to lead on this, but closely followed by Sean, I understand. Thank you.
Thank you, Councillor Woolley. Yeah, I'm going to step in just very briefly, and Sean will go through and pull out the setting points in the paper. The Health and Wellbeing Board will be aware that housing is one of our priorities in our strategy, and so we receive as a board updates on what we're doing against that strategy, and that's what this paper outlines really. So 6 main collaborative work streams around the wider Homes for Independence programme as outlined under the summary, and there's more detail that, as I said, Sean will pick out as he goes through. key thing to recognise really is that underneath the Health and Wellbeing Board, we've got the Housing, Health and Ageing Well Delivery Group, which is the key mechanism really to pull all of this together, because clearly housing is a district authority responsibility, but there's lots of overlaps with a whole range of different partners, and that group is co-chaired by Councillor Boker and Councillor Gray, so I'm sure they would speak to that were they here. Our vision remains the same as originally outlined, which is for people to live independently, stay connected, and have greater choice in where and how they live, for both Homes for Independence and Ageing Well priorities. That's how it's come together. I won't say anything else. I'll pass over to Sean to go through a bit of the detail.
I did push it. That's better. Yeah, as well as the vision remaining the same, the main areas of focus, as outlined in the paper, also remain the same and have done for a while now. But the Housing, Health and Ageing Well Delivery Group has recently assumed the remit for Ageing Well, so there has been quite a bit of work in the last few months to refresh and reform the group with new membership. So Michelle's here today, and Michelle's a relatively new member on the group, joining Councillor Nanastad, who's been on the group since its inception. There's a separate Ageing Well delivery plan in development. Obviously, we're here today to look at the Homes for Independence element, but I think it is important to recognise that housing is one of the priority themes for Ageing Well, and there's therefore that overlap with it in itself, but also subjects like tackling social isolation, which are essential to actually creating a good home for someone in the right location. So the Homes for Independence delivery plan is also being refreshed to meet the new objectives that are set out across the life course in the Joint Health and Wellbeing Strategy, and the actions that are then in the accompanying action plan are also being worked on. This has been done through allocating deliverables to one of 3 subgroups that now support Housing, Health and Ageing Well Delivery Group. That's down from the previous 5 subgroups to try and streamline things a bit more, despite the creation of the new age-friendly Lincolnshire working group. But as Derek mentioned, there are 6 main collaborative work streams that are outlined in the paper. I'll just give a very brief update on for each of them. So the first, the Public Health Intelligence Team, is continuing to align housing intelligence with population health management and health inequalities data. We are now at long last ready to commission the Building Research Establishment Housing Stock Insight Service, and that will provide us with a foundation for further analysis and for targeted interventions. One example that we've already begun working on is looking to target energy efficiency improvements to homes, at cold and damp homes that we know are occupied by children with asthma and other respiratory conditions in particular. The second is that the Good Home Links hub has been launched at the summit that Councillor Woolley mentioned a few moments ago. We now have a whole host of information on the Connect to Support Lincolnshire website, including a healthy home assessment and an interactive house that residents can use to help identify issues with their homes and the solutions to those issues. For those people who then require further support, we have a 2-year pilot advice and casework service that commenced a few weeks ago. Given the current economic climate and today's rise in energy costs, improving the energy efficiency of homes is never more important. The work of the local energy efficiency demonstrators has been great in the last couple of years, but we recognise that the government funding for those comes to an end at the end of March 2025. For all of this, we're really, really pleased that we're now working with the London School of Economics, who are evaluating the Good Home Hub for us, and that's with a view to demonstrating the value of the hub itself, but also those local energy advice demonstrators and the hoarding support pilot project, so that we can ensure some continuity. The hoarding support pilot project itself is a limited support service at the moment for 12 months based in East Lindsey, and does what it says on the tin. It's there to support people who hoard, to resolve that hoard and keep free of clutter in their home. But it also includes the potential need for dedicated therapeutic support to help people achieve that. The fourth area is around financial assistance, which has continued to be centred around the Disabled Facilities Grant that's part of the Better Care Fund. District councils have now all adopted a common discretionary housing assistance policy to be able to use that funding more flexibly, but that's only insofar as demand for mandatory disabled facilities grants themselves allows that to be the case. A quick new insertion to the report, if I may. The government announced yesterday a new Warm Homes local grant, which will be available to local authorities, provided that they submit an expression of interest that they want to deliver this new scheme by October. So just like to slip in that the board could encourage eligible local authorities to actually express their interest in that fund. That would be fantastic. The fifth area is homelessness and rough sleeping, which has obviously been a priority focus for a long time. It continues to look at increasing accommodation that's available for the cohort, ensuring there's adequate and appropriate support for individuals to sustain tenancies and manage their health conditions, and to improve relationships with mental health teams and avoid cases becoming more complex than they need to become. Finally, the last area that's highlighted on there, whilst not the direct remit of Housing, Health and Ageing Well Delivery Group, is that 2 extra care housing schemes are making good progress. Diamond Court at Prebend Lane in Welton by Lincolnshire is now well under construction, and Grange Farm in Market Raisin is on the way. Just to round up then for the future, the workshops that were held at the summit referred to are helping direct future focus for the group, and that's going to be particularly on cold homes, homes suffering from damp and mould, disabled adaptations, but it also includes a lot more joint working with providers of social housing in the county, so we can make best use of the social housing stock. The refreshed delivery plans will be presented to Housing, Health and Ageing Well Delivery Group soon, but I think crucial to the success of all of this, and quite an ambitious work programme, is continuing to resource the initiatives that are outlined in the report. So the board's asked to note the progress made to date and to support the planned initiatives, but also to support us levering in some of that external funding like the Warm Homes local grant. Thank you.
Thank you, Sean. Before I open it to questions, can I just say what an excellent paper this is? And if it tells us nothing more, although it does tell us an awful lot more, just exactly how much housing impacts on our health and the health of our residents as well. So, and it's a sort of a double pat on the back, because I think it was officers here who very early on in the life of the Health and Wellbeing Board suggested that housing, good quality housing, should be a priority within our strategy, and my goodness, has it proved to be the case. So thank you for that. So questions or comments from anyone? Councillor Nanstead.
Yeah, thank you, and thank you for the report, because there's some very interesting things within this, and housing is very important, not just for people's mental health, but their physical health and their education of children, because if they're in a good, stable home, they've got a far better chance of making progress than if they're in temporary accommodation or they're having to move around. I think it's important, that homelessness is really quite important to be involved in this. And I have seen that some councils, Suffolk, Birmingham, Cambridgeshire, have cut housing-related support or scrapped it altogether. Now, Lincolnshire a few years ago did cut its housing-related support. Are there any plans to change that?
Says she. I will pass it. Derek.
The current contract is due for, well, it's come to an end, so there will be the normal council process to go through, we'll go through the normal council process about whether we recommission, if we do recommission, how long for, and what the process would be. So we're just starting that process now, but it's just normal recommissioning type process at this stage. No final decisions have been made as far as I'm aware anyway.
Do we have any timescales on that? Or would it be fair to say to Councillor Nanstead, please ask again at the next meeting? Or?
Yeah, I'd be happy to get an update when we're at that stage and share it with members of the board, if that would be helpful.
Yes, please. Thank you.
Briefly come back, because obviously it's very important, and actually when the previous cut was made, the prediction was that homelessness would go up, and it did. And recently homelessness has been increasing a lot in places like Boston, East Lindsey, Lincoln, way beyond what it was before, and really it is important that that service remains.
I think we'd all echo your concerns, and I think that Councillor Boquet, if she was here, would also agree with you, because I know that she's often remarked on the numbers that are increasing on the East Coast as well. So it is a live topic without doubt. Thank you. Any other questions? John?
Thank you, Sue. Oh, already on. Yeah, just thank you, Sean, for the paper. Thank you, Derek. Just a couple of quickies, please, if I could. Firstly, the Centre for Ageing Better that's referenced in here. I must say I've just lost sight of what is that a national advisory service, and if so, sort of where does that sit, and can you describe how that relationship with them is working? And then secondly, this additional allocation that I presume we're going to be putting our hat in the ring for. Any sort of sense of what the quantum is of that? And I'm looking at you, Derek, but I know that Sean's going to be answering. Is and have we got a set already a bit of a list of priorities that we've got in mind in terms of how we're going to apply that and how quickly we can apply that? I mean, for example, is that something almost here and now ahead of winter, or is it a longer burn as well? So I'll pause there. Thank you, Sue.
Thank you. So, Derek.
Shall I let Sean do the second one first, because that's the one
Makes perfect sense, yes.
just in terms of the because it was only announced yesterday, I think.
Yes, so I'll caveat this answer with the fact that I only read it very briefly this morning. It's actually a scheme that's going to replace the existing schemes, which are local authority delivery and home upgrade grants. So I believe it will actually kick in when they end at the end of March next year, but those other schemes will continue as existing. For the first time, though, this new scheme isn't being run as a competition, so fortunately the local authorities don't have to bid. There will be an allocation of a set amount of money for each, provided that they submit the expression of interest to say, yes, we want to deliver this service. The government have then set out some quite detailed guidelines around who will be eligible for the funding for the measures. It's around targeted postcodes according to the indices of multiple deprivation, or households that fall outside of those areas with a household income of less than £36,000. So it will be specifically targeted at those who most need it, and essentially it's to fund insulation measures to the fabric of the home and sustainable heating systems such as air source heat pumps, so that it helps the homes also decarbonise as well as keep warm.
Thank you. And Derek?
Yeah, and in terms of the Centre for Ageing Better, Centre for Ageing Better were a national charity, I think, Sean, that were funded by the big lottery fund, was it? And Lincolnshire partnered with them because we'd already done a lot of work in this space to develop new models of how to support people as they age to age better, to age well. Their funding was running out nationally, and so rather than try and keep two separate streams, that was part of the stimulus to bring together ageing well with the housing agenda and into the new board that we've got. So we did quite a lot of work with the Centre for Ageing Better, and now that's all incorporated within the new board that Councillor Bowkett chairs, and it'll develop in tandem going forwards.
Okay, any more questions? So I've just got a couple. One is ridiculous, but I'm still going to ask it. On page 25, the penultimate para, why is the acronym for the local energy efficiency demonstrators LEADS with an A in it rather than LEADS with a double E in it? You don't have to answer that if you don't want to. This is slightly unfair, unless you know, but also in that paragraph it mentions why one of our districts wasn't part of this particular initiative. Is there any reason for that, or that you're aware of?
So first of all, the acronym is me slipping back to the old name of Local Energy Efficiency Advice Centres, when the new centres are called Local Energy Advice Demonstrators, or LEADS with an A. In terms of the Good Home Links pilot, the district council is only not part of the casework and support element where they weren't able to fund the 3 caseworkers that we have. They are absolutely part of the advice offer through Connect to Support and have been contributing to the content for that.
Okay, thanks for that. That's helpful reassurance. And then over the page, on page 26, you have mentioned, and I think I heard you say, with this Warm Homes grant that you mentioned was rolled out yesterday, it's the districts that, in our case, that will be eligible to apply, not the upper tier, is it?
The allocations are certainly given at district level. I think perhaps technically by the definition of local authority that they've given in the guidance, that county councils or even combined authorities could possibly bid as well, but it would make sense, in my opinion, for it to be the district councils.
Thank you. And then finally, just back to you, Councillor Nanstad. I've been advised that the housing-related support is on the agenda for the November the 5th meeting of the Health and Wellbeing Board. Executive, sorry, not the Health and Wellbeing Board. Thank you. Any other questions or comments? Okay, thank you. Children. It's the early intervention and prevention supporting children and young people's health and development across children's services. Linda, are you introducing it and then passing to Nikki and Lynn, or do you want to go straight to Nikki and Lynn? Thank you, Lynn.
Thank you. So we were asked to bring a paper here today to give an update in terms of each of our services around early intervention and prevention. So I'm here to report on the health visiting service, and we'll focus on 2 areas. Nikki's going to present on the Family Hub programme. Then we've got Bex that's going to look at SEND, and then we've got Kevin that's going to look at the mental health. So I'm going to hand over to Nikki first to do the Family Hub element.
You've come in force then.
We have. Thank you. So I'll start with the Family Hubs. So Family Hubs were championed in the government's 2019 manifesto, and the programme is hosted by the Department for Education and the Department for Health and Social Care. And the overall funding allocated to the Start for Life and Family Hubs programme for Lincolnshire over the 3-year period is just over £5.7 million. We're now in the 3rd year of funding of the programme, and this runs till the 31st of March 25. Family Hubs aim to make a positive difference to parents, carers and their children by providing high-quality, joined-up whole family support services to all families with a specific focus from conception to the age of 2, and to those children of all ages, which is 0 to 19 or up to 25. But I guess at the heart of it is that real strong core offer of Start for Life services. So the key areas for the Best Start for Life include ensuring families have access to the services they need with a seamless and coherent joined-up Start for Life offer in a welcoming hub, and we're using our children's centres as the hub. and including providing information for families when they need it via digital, virtual and telephone also. Ensuring the Start for Life system is working together to give families the support they need, empowering the Start for Life workforce to meet the changing needs of families, and continuing to improve the Start for Life offer in order to further improve outcomes for children and families. So the specific areas that were funded through this programme are parenting support, parent-infant relationships and perinatal mental health, early language and home learning environment support, and this is specifically aimed at COVID recovery, so for those children born in the pandemic who are now 3 and 4, infant feeding support, and parent and carer panels, and publishing the Start for Life offer. We know in Lincolnshire and across the country, we have seen a number of children with missed experiences following the COVID pandemic and the cost of living crisis. In addition, we have seen an increase in the number of educational health and care assessment requests for the local authority receives for children within the early years. The Start for Life and Family Hubs programme, along with other system-wide initiatives such as the Families First for Children Pathfinder programme, aims to benefit those children impacted the most through offering enhanced provision within the greatest areas of need. The corporate targets relating to Family Hubs for 2023 and 24 were all met. These included launching 10 designated Family Hub sites across Lincolnshire, devising a training plan to incorporate the new evidence-based programmes and necessary workforce development, including delivery of the programmes being in place across the majority of the funded working streams. Launching a small grants programme to offer opportunities to the wider sector to include voluntary, private, independent and faith groups. The corporate targets relating to Family Hubs for 24-25 are around embedding the Family Hubs programme, measuring the impact of these services and evaluating their effectiveness. In order to meet the requirements of the programme, we are developing local strategies which need to be in place for March 25, and these include the Lincolnshire Breastfeeding and Infant Feeding Strategy and Lincolnshire's Parent-Infant Relationship Strategy. These are both on track to be in place for October 24, and once they have been approved by the relevant system partnership boards. Lincolnshire is an outstanding local authority and as such has a strong children's health, early help offer and 48 established children's centres where the Start for Life offer is delivered. With the extra funding, Lincolnshire has enhanced provision and support to families across the county. Through a locality needs assessment, we identified 10 children's centres at reach areas that would benefit from extra funding to enhance Start for Life services. These cover the county and the detail of the centres you can find in the report. As the existing early years workforce are already in post, their roles have been reshaped to deliver the elements of the Start for Life and Family Hubs programme to support sustainability and not to risk redundancy should the programme cease post-March 25. As the Start for Life and Family Hubs programme was intended to be a 3-year programme, sustainability was considered from the outset. A transformation multi-agency workforce development approach was taken to train our core Start for Life and early years team in the new evidence-based programmes, and this upskilling of staff will drive positive outcomes. This core workforce predominantly includes staff across the early years system. For further sustainability, a training grant process has enabled community, voluntary and faith sector organisations, including maintained nursery settings, to access funding, training for evidence-based programmes, as these are able to be rolled out within the community. Sustainability for some areas of the programme is now being sought, and an evaluation of the revised Start for Life offer is being undertaken by our strategic commissioning team, and an independent review of the home learning environment, which focuses down on the 3 to 4 year olds, has taken place under the University of Sheffield. I'll now hand over to Lynn. Or is it Lynn? Bex.
Thank you. Within the SEND sector, we've seen quite a significant demand for children with special educational needs and disabilities, and currently in the country there's 1.6 million children who are identified as having SEND. And in Lincolnshire we've seen a notable increase in education, health and care plan requests, where we've requested assessments due to different areas of need, but predominantly autism spectrum disorder, social, emotional, mental health needs, and speech and language and communication needs. The statutory education, health and care process involves multiple stakeholders, but workforce development and the shortage of educational psychologists pose challenges to us in SEND, and the quality of information received from our partners, health and social care, can sometimes be inconsistent. The SEND reforms took place in 2014, so we're now 10 years on from them reforms, and the government started to relook last year at what we're going to do moving forward, where we've got these demands increasing. What we've found from the reforms is that it hasn't necessarily gone how it was expected to go, and we're seeing that parents, young people and professionals remain unhappy with the SEND system. The government proposed further reforms in 2023 with a SEND and Alternative Provision Improvement Plan. And this has led to further work taking place in different local authorities where they are trialling different proposed points of that plan to see what those reforms may look like in the long term. So here in Lincolnshire, we have a school population of 108,725 and 14.16% of the school population are identified as having SEN needs and are receiving SEN support. So nationally, that's 13.4%. And with 5.3% having an EHCP, an Education Health Care Plan, against the national rate of 4.7%. So we're seeing that in Lincolnshire, we have got a higher demand. And the demand for the assessments, the Education Healthcare Needs Assessment, has grown nationally. And within Lincolnshire, we've seen a growth of 36.6% in requests for assessments. Not all these requests for assessments lead to full assessments, but those that do, we are seeing a real raise in plans. So we now currently have 8,148 education, health and care plans. So although we've seen increase in growth across all age ranges, we are particularly seeing a growth in the yearly years cohort. So the demand has really grown, and we've seen 2022, there was 399 requests for assessment. So far this year, up to the end of July, there has been 317. So we're predicting that those figures have almost doubled in a 2-year period. So we are also identifying that a lot of those, a high proportion, 35%, are summer-born children. So we are investigating and starting to look at why that is. And what we are noticing as well is we've got a very good, strong graduated approach in Lincolnshire where the support is put in place at the earliest opportunity. We're now starting to focus on what happens before the graduated approach, so before it's identified as being a special educational need. So the SEND workforce is a growing area. We are currently a team that consists of about 60 to 70 professionals. We're not like a social work qualified team that has a specific qualification that underpins what their practice is, but we are starting to see we've got a mix of teachers, etc. in the workforce. But what we're noticing is we trying to sustain that skilled workforce and experience and resilience within the local authority team is becoming more challenging, and due to the complexity of the work as well, we're not starting to see a real growing demand in that area for recruitment, and some local authorities are relying heavily on high-cost agency. Fortunately, in Lincolnshire, we are not in that position. We have managed to continue to grow our workforce, but that is an area that we really need to continue to develop, and to develop the workforces around us, particularly in the early years sector, and giving them the confidence in identifying needs at an earlier opportunity. The legal framework underpinning the EHCP process stipulates that the local authority must engage the skills of an educational psychologist, which also brings great challenge. We've had to be quite creative in Lincolnshire in creating our own model where we do use locum and agency EPs to keep up with demand. And due to that, we are one of the highest performing local authorities regarding our statutory duties for assessment. So one of our areas that we really need to focus on is that quality of information as well that is received from our health partners, our social care partners and our education partners to really develop high quality assessments and EHC plans for our children. We are currently approaching a period where we are due our SEND inspection, and we are now under a new inspection framework which was started in 2023, And that now has a real different focus on, and it's really following that journey of that child and young person. So starting right from the beginning of that early identification and following them right through on their journey. So a real different focus to what previous inspections have had. So we are currently preparing for that, which we hope will come in the near future. Thank you.
Thank you. So with regards to health visiting, there was a report that was published this year suggesting that children born in England now have some of the worst health outcomes when compared to similar nations. So this obviously in terms of the main concerns are being around health inequalities, which are widening, a growing concern around those most vulnerable children being invisible within society, and also the increasing costs of late intervention and reactive services. So it is a key public health priority moving forward. With regards to health visiting, they do deliver and lead the Healthy Child programme, but it is delivered by a skill mix, and sometimes other services support the delivery of that. And the model is aimed at early intervention and prevention. It also links in with the Best Start for Life and the first 1001 critical days. So the Healthy Child programme has 5 mandated contacts, and then there's some high priority areas as well that we focus on, but with the overall aim of making sure that children achieve their lifelong emotional and physical well-being, and predominantly are able, when they get to school, to learn and develop to give them the best outcomes in life. So very much the Healthy Child programme links with the objectives of the Family Hub model as well. In Lincolnshire, we have benchmarked ourselves against the State of Health Visiting report that was published in 2023, and they're just doing their new report at the moment. That questionnaire is out. And it did evidence a depletion of about 40% in health visiting numbers. And obviously without the health visiting workforce, we're unable to deliver on the Healthy Child programme. And I will come on to this staffing a little bit later. I just wanted to focus on one area, which is around infant feeding. So unlike the national picture, Lincolnshire has promoted health visiting. Funding has been protected and services were protected whilst we were in shutdown, lockdown even, due to COVID. We were also supported to enhance our services and our skill mix workforce, so we have introduced nurses, which has enabled the health visitors to actually focus on those children that have got the most need and are the most vulnerable, and that very early part of life as well. So when we're looking at breastfeeding, we do measures, and obviously we are looking at those that are receiving breast milk as their first feed. And then we look at the totality of those partially or totally breastfeeding at 6 to 8 weeks. With the interventions that we've put in place, so we have developed our breastfeeding network, and that's across the whole system. And as Nikki mentioned, we are in the process of developing a infant feeding strategy for Lincolnshire, which is also systems and partner-wide. In terms of the health visiting aspect of that, we have developed a new peer support role, which are parents that have had their own breastfeeding journey and have links within the community to be able to support those parents on their breastfeeding journeys, as well as our breastfeeding parent volunteers that we have in our breastfeeding groups. It's also, as part of that, we've also developed an antenatal education team, so that breastfeeding conversation very much starts whilst they're in that pregnancy. And pregnant ladies can visit our breastfeeding groups. It doesn't have to be postnatal, they can visit those in the antenatal period. And the idea of the peer family support worker is so that they can support those parents in the antenatal period right the way through to just post-birth. We've also extended our infant feeding champions, so there's a infant feeding health visitor champion in each of our 12 health visiting groups across the county, and we've also trained 4 lactation consultants, so they're health visitors with additional training and support to be able to provide support to those mothers with the most complex need around breastfeeding. We've also introduced a specialist health visiting who goes across all of infant feeding and very much is going to steer the infant feeding strategy as well. We've also looked at joint pathways between midwifery and health visiting to make sure that there is clear strategies across from the midwifery service into health visiting, and mothers aren't dropping off in the interim between when midwifery discharge and we pick them up at day 10 to 14. We've also ensured that we've got more people trained in the UNICEF breastfeeding training, and we've developed that wider, so it's not just children's health that have that training now. We've got a training package that goes across all of children's services and midwifery services. All of this has actually shown an increase in those that are still breastfeeding at the 6 to 8 week that were breastfeeding at the primary birth visit. It's increased from 74.1% in February 24 to 80.1% in June 24. So we're already seeing increases in those numbers. Also, when we look at the data that we get from midwifery, those that are breastfed as first feed, and we look at the sustainability rates to those breastfeeding at 6 to 8 weeks. We've also met the target on that, which is above 40%, which we've not done in the previous 2 years. So all of the indicators are going in the right direction. And then I've just put a couple of pieces of feedback from the antenatal education team and one of the breastfeeding groups, which I think says it all. Moving on to our workforce, as I mentioned earlier, nationally they'd seen a decline of 40% in health visiting, but I think it's something to celebrate that in Lincolnshire we did see a decline and we did see our vacancy rate increase significantly, but we've done a lot of work on that and we've seen a huge decrease in the last 2 years on our health visitor vacancies. So we're very much focused in on our Grow Our Own model. So we do link in with Sheffield Hallam University, and we've just had 6 students that have qualified. So we've got 6 newly qualified health visitors that have started in September in the teams, and we've kept all 6. Historically, we found that they would often move out and go and work in other counties, but we've decided that we will offer them a permanent job when they start their student role, on the exception that they obviously successfully complete the course, and we've found that really successful. And for the first time in September, we actually filled all 9 of our student places. So hopefully this time next year, we'll have 9 more health visitors going into the work stream. We've also, as I mentioned earlier, introduced the new nurse role. And I heard somebody mention earlier around the training status for United Lincolnshire. We're linking in very much with Lincoln University, and we have actually had successful applications from newly qualified nurses that have done their training at Lincoln University as well. And they've actually gone on and were successful in an application to become a student health visitor. So they're seeing those career progressions, and we're actually keeping those staff within Lincolnshire. And I think that needs to be celebrated because that's a system-wide approach to making sure that we can deliver services in Lincolnshire. Obviously, moving forward, the service is currently under review at the moment and in line with the family hub. So we're hoping to have an outcome of the health visitor review by March next year. And that is very much looking at how we can make sure that we continue to have early intervention and prevention and really focus our key service deliveries on that 1001 critical days. Thank you.
Thank you. So I was asked to provide 3 areas of update within the report, so I'll take each of those in turn in terms of a summary. So the first update was in relation to the Children and Young People's Mental Health Transformation Programme that's currently ongoing. The programme was agreed in 2022, kind of in recognition of the increasing demand on children and young people's mental health services and to develop a clear plan for future funding and what we'd prioritise that on. So we've spent much of 2023 and so far in 2024 gathering that information, data and intelligence to inform our modelling and future service transformation and development. That's included a wide range of engagement with public and key partners and analysis of that data and intelligence to identify any gaps and priorities for improvement, and we're just starting to look at our options for progressing into our modelling. So obviously throughout that time there's been a lot of key findings from the engagement, but just to highlight a few, kind of there's a need to broaden our offer of support even further to reach children, young people and families who aren't currently accessing the existing services that we have. We do have capacity within services, but we know that kind of we need to provide options that people will choose to access. There's a clear preference for face-to-face support, but people do want options for various digital support that complements the other services. There are some health inequalities that we've identified that we need to address, particularly around access in areas of deprivation, access for older young males, neurodiverse young people, children in care and our care experienced young people. Parents, carers and professionals said they would like more training, education and support to increase their confidence in supporting their young people. And we need to improve our access and provision of local community support through the voluntary community faith and social enterprise sector, particularly some areas where we've identified gaps around support for children, for older young people, 14 plus, non-physical or sports related activities, and specific or inclusive groups for LGBT, SEND and neurodivergent children and young people. So we've developed a new framework for the future model, which we're using to now progress our service modelling. So we increase mental health promotion through creating a robust local community support offer and developing the How Are You Lincolnshire website to include information for children, young people, families and professionals that work with them. Clear, coordinated, comprehensive training and education offer for children, young people, families and professionals. Simplified access to support for children, young people, families and professionals, increasing availability of that first line advice, assessment and consultation. Equitable and expanded education support across all types of early years and education settings or our home educated children in Lincolnshire. Expanding the proactive targeted support that we offer to children that are more likely to experience mental health difficulties. Making our specialist mental health support and interventions more person-centred, based on need and clinical guidelines and best practice, as well as being more inclusive of the wider family, not just focused on the child and young person. And strengthening and further developing our urgent and emergency mental health offer with an increased 24/7 support, crisis and respite provision and day hospital offer. So we're currently working up recommendations for our future service modelling and transformation, ready to take through decision making in 2025. The second area of update was in relation to development of mental health support teams in Lincolnshire. So since 2019, we've rolled out 7 mental health support teams in line with the national rollout. So we've got Lincoln, Gainsborough, Boston, Skegness, Spalding, Sleaford and Grantham. We've got 2 more that one's currently in their training year and due to become operational in 2025, and that's in the North Kesteven area and kind of incorporating South Lincoln area, and then in 2026 covering the Louth area in East Lindsey. So mental health support teams deliver direct evidence-based interventions for school-aged children and young people with mild to moderate mental health issues. But the team also offer workshops, group sessions, parents' evenings, and a whole host of other support, as well as helping schools and colleges to develop well-rounded whole-setting approach to emotional wellbeing and mental health. The national target's for 50% of the country to be covered by mental health support teams by 2025. So Lincoln's on track to achieve that. We've got, by that time, approximately 46% of education settings that will be covered, but that actually accounts for 60% of the total pupils within Lincolnshire. And Lincolnshire is one of the highest performing areas for access to support via mental health support teams, particularly within the Midlands region, as well as that wider education mental health support offer via Cooth and Healthy Minds Lincolnshire, and contribute 18% to the regional access figure. That was at March 24. Last bit of updates was in relation to the Children and Young People Social Communication Pathway, which includes our assessment and diagnosis of autism. So the pathway is led by community paediatricians within United Links Hospital Trust, but it does involve a multidisciplinary team of professionals that include speech and language therapists in Lincolnshire Community Health Services and clinical psychologists within Lincolnshire Partnership Foundation Trust. As with other areas nationally, we've experienced increased demand for autism in recent years. That's reflected in some of the discussions that we've heard already today in the number of pupils with special education needs with a primary need of autism. We did have, so there was some local investment pre-pandemic which saw gradual improvement in our waiting lists around autism diagnosis to around 12 months with around 500 children and young people on the waiting list, down from nearly 1,500. But because of challenges during the pandemic, autism assessments couldn't be carried out as they had to be face-to-face, and since then we've seen that massive increased demand. Referrals for autism increased by 78% from 21 to 24, particularly for children in the early years, which now accounts for 39% of referrals. The increased demand has outpaced capacity, and we are seeing longer and longer waiting lists now as they can't keep up with the demand. We've escalated our concerns locally to highlight the scale and risk of the challenge and to agree a shared responsibility for improving those services. We've identified around £300,000 of non-recurrent funding that we're currently looking at how we could provide immediate support into that pathway. We're just looking at kind of the options around funding additional clinics or considering commissioning assessments via private providers. Longer term, a new autism assessment and support pathway for children and young people is co-designed in 2023 with members of the autistic community and specialist clinicians. We've held a number of multi-agency workshops since the beginning of 2024 to consider how we could move towards implementing this new pathway. And we're working with the ICB on a case for change with a review to requesting phased investment as part of the NHS system planning from 2025-26 onwards. We're also exploring options for an access team to support inquiries and referrals for autism and other neurodiversity, and we're linking that into the transformation programme, the mental health transformation programme, considering integration with the existing mental health access team. Thank you.
Thank you, and thank you to all of you for that update. Before I open it up, can I just say, I thought I heard you say that we're short of educational psychologists. Can we have some more, please, Professor Juster? Can you train up some students to be educational psychologists?
Indeed, we could if we could get the students to come to us.
That's obviously a job for the rest of us to do then, to encourage them to come to Lincolnshire. I think they're starting to get the hang of it, though. I think they're finding that they like to be here. So everyone else, any comments or questions that you would like to ask of any of the presenters at all? John.
I'll have a go whilst others are thinking. Thank you for all of that information and the way you put it over to us. I found that really, really helpful and interesting. I might be the only one in the room, but I'm thinking that there's something about this. Should we be, how can I put it, really worried about some of the key messages that you've shared with us? You've very clearly been able to describe work that's been undertaken over the past few years and patterns there. Obviously there's some top class things happening, but some other areas where I think we should, as a Health and Wellbeing Board, be a bit concerned about the themes that are emerging. I think I'm left with a thought of I'm not quite sure how all of this projects forward. So it's more of a, how can I put a description of how the land lies today and what's been delivered and what's happened over the past couple of years, which I say is really, really helpful baseline. Sorry, you know what I mean. It's a really great understanding, but I'm not quite sure where that takes us really in terms of the next few years. Are the trends that we've experienced in the past couple of years going to continue? How are we projecting all of that forward? What sort of general resources are we going to have available to us to apply to future demands? What are the implications on county council services, on health services, be they mental health services, be they secondary care, community, general practice services, so much what should we strategically be paying attention to, looking forward. So I'm left with that sense of obviously some brilliant stuff happening, a lot of concerns being flagged as well, but where strategically are we going in Lincolnshire for our children and young people? If I am alone in the room with that concern, then just please tell me.
Linda, do you want to have a go at that one?
I mean, that's a very good question, and I think it's something that we all kind of struggle with on a daily basis. And I think it's just part of, I think, what's happening in its widest sense around that increasing gap in health inequalities. And I think the challenge is, I mean, absolutely, people could always do more with more, but it's not about doing more with, I mean, needing more investment. I think it's sometimes the way that we do things. I think population health management, I think we really need to be focusing in more on that as a system in terms of identifying what our priorities are. I think we know where our vulnerable groups are, but I think it's in a way, how do we bring that together in a strategic way to really focus our investment? I think there needs to be a shift into early intervention and prevention in terms of spend, and I think that's been played out anyway in some of the government objectives, isn't it, around shifting to community and prevention and less focus on the big hospitals, if you like, and the acute, but we all know the challenges are around shifting money around the system. So absolutely, it's a really good question. I don't really have any answers. I just think it's about how we work together as a system. I think become more sophisticated in how we use population health management data to agree as an integrated care system, what are our priorities? I mean, obviously for us, we would say children and young people. We realise that's competing against frail elderly, you know, huge waiting lists across every sector of the health service. So absolutely, I don't think any one of us has one answer alone. It's about how we work together going forward. But I think it's really about, you know, really setting those strategic priorities and where do we want to invest. We're very good at innovating and doing the best with what we've got, and I think you've seen some really good examples of that today. But as always, there's more that we can do, and I'm sure Derek will come in.
Yes, Derek, did you want to just come in on the back of that?
Yeah, just to pick up a couple of the themes and then a suggestion about way forwards. When we were talking about this, there are some very clear and evidence-based challenges around SEND, EHCP. We have seen a very significant increase. The DPH report a couple of years ago wasn't a DPH report, it was mine with Heather, and we were already seeing, as we were just coming out of COVID, pretty well doubling of the number of children, young people who needed support. Speech and language therapy as well plays into this, but you have to keep pushing it back into a more preventative model and supporting families, young people around that space. And that, I think that runs through all of this like a stick of rock, doesn't it? In the same way that meeting some of the challenges of health inequalities plays out from that. And we're having these conversations in other fora around meeting the challenges around health inequalities doesn't mean an equal offer across the county. It means, by definition, an unequal but equitable offer. So you're providing more support where more support is needed and less where it's less. That's quite a big shift, especially in a universal free at the point of care sort of health service system. So I think in conversation with Heather, the plan really, we had a bit of a cunning plan, was to have this conversation, to get a lot of the lay of the land as you described it, John, today, and then to take that conversation into an integrated care partnership workshop discussion and really start to think, okay, great, so we understand fabulous work that's being done across the system, but the challenges are going up and up and up. Hopefully, we'll start to understand what the government's perspective is on this, and then we can start to talk about it at a system level in the integrated care partnership workshop. So this was a bit of a wet your whistle, and then move into that. And same argument with older adults and frailty. I think we're going to bring a paper here and then have a workshop on that afterwards as well.
Thank you, Derek. Councillor Marfleet.
Thank you. I'm with you on this one, John. I can't quite decide whether I sat on a time bomb waiting to explode, but there's definitely, I mean, I look at sort of, you know, I live opposite a primary school, and you can see what's going on in effect with the whole sort of approach. I mean, some of my mates have got young kids, and some of those kids just sit and watch TVs all day, and actually that sends them much more hyper in their outlook, I think. Others are sort of more in the old-fashioned way where they don't watch any screens, TVs, and you definitely see changes and impacts of all this modern day life. And you know, we can't stop it, we can't go back. The only thing we can do, I think, is that I think people are completely lost on what's right and what's wrong and the fact of the everyday functionality of life. And I think the only way is preventative is to sort of, in some sense, highlight there's some sort of, when they have kids and things, and that there's a booklet explaining, not a booklet, but like a pamphlet that's just, but the thing is, a lot of the pamphlets get too complicated and actually people turn off. And I think you need a sort of really quite basic sort of stuff just on sort of guidance, because actually I think half the time people have lost in it all, and and it's just all too easy to bung a screen in front of a kid and run back to the kitchen and hope that everything all works itself out. And and then you've got all the other issues of exercise, eating. I mean, gone are the old days where we used to take the kids out, tire them out and tire ourselves out, and then you'd get back and at least you knew you got a few hours respite before they set off again. But nowadays they just stay and set off. So I think, what Derek said there, it's good to bring it all together and try and get this. But the more you sort of hear all these issues going on, if we don't start and address it, and the more we dive in, the more it will more will come out. But at the same time, I think we have to just view that, I know a lot of mums see this like a bit of a fashion thing as well. Oh, my kid's been, and they're all applying, which is why you're getting a high rise, because actually they all think they're going to be a little perk. They'll either get a bus ride or there'll be perks on the back of the fact that the child has been assessed for something. But the assessment's another issue. I think that perhaps needs to be a quicker bring on AI. I think it'll help us out in a lot of these assessment things, to sort of not reduce staff, but to help scan quicker to make sure that we actually get those in need straight into where they need to be. So, yes, modernness is going to have to come to us as much as it's coming to the children, and we'll have to just work our ways around it. But I think Derek's right, a workshop just to help bring everybody together and start to actually do it, or else we're going to be spending money everywhere and not really solve a problem here.
Thank you, Councillor Marfleet. I think, as we all know and have been told, those of us that have had children, there isn't a manual anywhere, and boy oh boy, I wish there was. But on that note, let me pass over to Councillor Nanstead.
Yeah, thank you. I'm not sure I agree with all that Councillor Marfleet has said, but some of the figures in here are quite worrying, because we're talking about very young children in some cases, and actually they're at the start of their life, and as they move forward they get older, and unless they're helped in the right way, they're not going to develop as they would hope to develop. I mean, some of these figures about waiting 12 months to have an assessment for autism, that's a long time for a family to wait. And you're talking here about we're now down to less than 500 waiting. Well, that's a lot of families. But the worrying figures, I think, for instance, 39% of referrals were for children and young persons in their early years. That's a lot. And now life has changed, and what life was like 20 or 30 years ago is different now. And it may be children behaved in different ways of behaving 30 years ago, but as life moves on, I think the whole thing changes, because their experiences change, what's available to them changes, some things disappear, some things come into being. So if you went back long enough, there would be no games to play on computers, but there will probably be things which were equally of concern at the time. So we're in a different world. We have to recognise that, and really do think that there needs to be some look at the resources available, because it's not going to go away, is it?
It may well not do, and we probably have got to look at alternative ways of working. Michelle.
Thank you, Chairman. It's a bit of a tenuous link, really, on what you've provided here, which has been a really informative, quite startling report. And it's on the back of what John asked as well. I'm just thinking around, you've mentioned COVID and the waiting lists that you're trying to get through, and I'm thinking about the COVID and those that tipped into the 18 to 24 bracket. And I know it's probably without your remit, but along the lines of John's question, I'm just wondering about the future workforce planning and the comment that Derek has often made about those economically inactive individuals, and what that's, if that picture is looking like that up to the 18-year-old age group, what's the picture between the 18 to sort of 24, 25 group that have missed out on these opportunities because of the waiting lists and the demand, and that we're obviously getting better, because I think some really fantastic work being done in there, and what that looks like for our workforce planning for Lincolnshire, for adult social care, for health, for all of our organisations sat in this room really, and wondering what, if any, knowledge and we have and information we have around that cohort and where that is, those challenges are sitting there.
Linda, would you like to have a stab at that, or shall we pass it over to Martin because it's his area?
I was just going to suggest perhaps Martin Mallis is more in the adult arena, isn't it? So
It's a very good question. I wish I had a very good answer. I suppose it's one of those areas where we're really needing to have a better understanding of where we are with the flows of people coming in, and trying to get that sense of where the opportunities are for young people and where they're being held back. So I'm aware that I'm not giving a very concrete answer here at all, because I think it's an issue that we're needing to work on. But I'm very happy to have further conversations and think about what we might do here.
Thank you, Martin. John.
Thanks, Sue. I'll be very supportive of us having a sort of session to have a really good look at that. And none of the comments I made were a negative critique. I thought they were, as a great description of the work that's undertaken, but also it flags a lot of challenges I think we've got here. Certainly as we step into setting that up, I'd like to see a lot more about future numbers. We've talked about trends here, trends with SEND, children and young people mental health, referrals not being as high as almost they should be in relation to national patterns. I'm sure there's things like birth rate and all of that sort of stuff that needs to come in. The whole focus on prevention, early intervention, and at a local community neighbourhood level, I think is absolutely what we're committed to. There's also things we've discussed in this setting previously about healthy weight for children, physical activity for children. I think smoking and vaping we've touched on as well. So all of this probably needs sort of pulling together. I think the only thing that one has a sense of certainty about in terms of resources in the public sector, particularly over the next few years, is they're going to be exceptionally tight. So I think in terms of as the size of the future problem becomes, I could put it, a bit clearer to us, no matter how strong a case for additional investment might be, it might simply be that any additional investment is very, very limited. So I think that puts a bit of an onus on us all in this integrated care system to think about the broader resources we all have available at the moment. So yes, that's money, and sometimes a bit of capital with money as well. But it's the people we've got, it's the skills we've got, it's the assets we've got the knowledge, the expertise, the know-how, and make sure that we draw all of our appropriate partners into that conversation. So that might be the education sector, as we've referenced, might be the university and maybe the colleges as well. I don't know. Certainly our third sector colleagues. So I'd really welcome us really scoping that next bit out. Thank you.
Thank you, John. Dean.
Thank you. And again, as everyone sort of mentioned, a really comprehensive report. I think for me, it was just understanding really the sort of figures around the autism sort of assessments and just trying to understand it, because the numbers sort of mention sort of pre-pandemic, and I just want to understand what the real state of that kind of service is at the moment, and understand that are we at the peak of that and things are going to get better, or is there still sort of those numbers still going to increase, and I suppose what that kind of trajectory is for improving the waiting times and the number of people waiting.
Kevin, are you answering that one?
I can do. I haven't got the data in front of me, but I can certainly kind of get that accurate data. We recently did a stock take in terms of the waiting times for 2023-24. It's difficult because it's a very complex pathway. Some children get seen for assessment quicker because they don't need as detailed assessment. Some take longer. But the average for 2023-24 was around 1.5 years. So that was kind of up from a year already from when we were talking about kind of just after the pandemic. And the way things are at the moment, there isn't the capacity within the system to be able to meet the demand for the number of children each month that are being referred. So that waiting list is just continuing to grow at the moment. But I can certainly look at some trend data of prior to the workshop, as we've discussed.
Thank you for that. Are there any... Derek?
Just to provide a little bit of assurance, one of the things that we're trying to do collectively as a council now is bring some of that population health management data set we've got in, align the analytical capacity we've got within the council with the performance capacity with expertise, and start to unpick not just where we are, but what the trend analysis would suggest the direction's going to be like over the next 5 years or so, and that will feed into the session in November. I think we've got planned. There's also a wider discussion across the health and care system about how we support people in this space, and also a wider societal conversation, which I know the Chief Medical Officer's flagged up around the very large increase in diagnosis, and how much of that is real and how much of that is potentially a medicalisation to be discussed. There's different views and different debates about that, but there's no question about how we can be more inclusive as a society rather than separate out, and that's one of the key things I expect the government will be looking at and will need to react to locally as well.
Thank you, Derek. Okay, are there any further questions or comments? Councillor Marfleet.
Just one thing. The only thing that often worries me in these situations is that we wait to make sure that we get evidence about how to sometimes respond and treat and resolve. And sometimes I think if we don't watch it, that takes quite a long time, especially on sort of topics like this. And sometimes recommendations or advice is better than just sort of sitting and doing nothing, waiting till we get an exact... And I'm sort of looking a bit more towards public health on this one, is that I know they love to sort of make sure they have things and measure things and it's all accurate and it's really detailed and it's everything. But sometimes I think we need to get advice out there quick, because actually waiting for technical information to come through generally takes quite some time.
I think it can take some time, but equally, when it needs to come out, it comes out mighty fast. So, yes, but I hear the point generally that you're making. So, thank you for that. Okay, can we move to the recommendation, which is to note this report and to continue the work together as partners? Show of hands, please. Are you in agreement? Thank you. Anyone disagreeing? Anyone abstaining? Thank you. Moving on to the item 7C, which is the Physical Activity Place Investment Programme. Emma.
Thank you, Chair. Hi everybody, I'm just going to give you a relatively brief update. You've had a paper in your pack around Sport England Place investment for physical activity in Lincolnshire. So I'll give you some of the headlines and then very happy to take any questions or have a discussion after that. I think just a reflection on the conversations today, again, some of the challenges that we've heard in terms of the CYP space actually moving forward. I think we can helpfully have some conversations about how physical activity can potentially be a short-term intervention to support people in that space that could ultimately help improve their mental health and well-being. So Active Lincolnshire is funded by Sport England, as you know, and we're kind of the guardians of the physical activity strategy for Lincolnshire. Sport England last year announced a place expansion programme, which will see them invest about £190 million across England into around 100 places of greatest need. The greatest need has been identified through a number of data sets, including inactivity levels, the Community Needs Index and areas of deprivation. So there are a number of areas of Lincolnshire that have been identified on that map in the top 25% areas of greatest need, and we are currently working on submitting a bid into Sport England for some funding to help us develop our place expansion programme here in Lincolnshire. The key kind of outputs around the programme nationally are to tackle inequalities, to decrease inactivity levels and increase activity levels, and provide positive experiences for children and young people, ultimately to improve the health outcomes and the lives of residents. It's very much a collaborative approach, working with and in communities, in places, to understand what those places need. And the work that we're doing already really actually highlights quite significantly the differences in some of our MSOAs, so even neighbouring MSOA areas, the differences in population, in health conditions, prevalence of health conditions, etc. So each place, we expect the response to look quite different, but there are some principles of the work that will be shared, and that will include a commitment to system-based working, the community engagement and collaboration with people that live in those communities. It won't be us doing things to anybody. It certainly won't be us putting in short-term interventions or distributing pots of money for somebody to put an additional class on, for example. It will be looking at everything from policies, planning, infrastructure, health conditions, the health services in the area, unemployment, economic inactivity, and so on. And Sport England have got about 7 years of experience of working in this way in other parts of the country, and are very clear that a lot of this is about the how. It's about how organisations collaborate, it's about how we come together, it's about behaviours, it's about distributed leadership, and it's about people. I think, you know, as a CYP conversation previously kind of highlighted that need to work together, because after the initial funding, which will take us to 2028, there's no commitment of further funding. So during that time, there has to be a commitment from us all to think a bit differently about how we embed and incorporate physical activity into our planning, policies, decisions, etc., and create a sustainable approach to enabling people to lead more active lives. The work clearly really aligns with the conversation around prevention and early prevention and enabling people to be more active from a younger age. I think in this room we're all really clear about the challenge of physical inactivity in Lincolnshire, and we've kind of been at a pretty similar level for a long time, so this is our opportunity to do something different. I think actually to be quite bold and to take some action that we hope will really start to shift the dial. But to do that, we have to have a really focused place-based approach, because we don't have the capacity to be able to do it across the whole county. So very much heavy emphasis on evaluation and learning, what change this work makes, what we learn from this work, and a commitment to absolutely roll out that learning and that understanding across the whole county. So whilst the immersive intensive work will happen in relatively small geographical areas, there's a commitment from all partners and an expectation, rightly so, from Sport England that we kind of lift and shift that to enable us to scale up some of the work that happens in those local places where we expect it to be able to see transformational change across a wider area. It's about moving away from transactional relationships, and Sport England, you know, admit that they have operated in that way previously. Here's some money, we want you to do this, and then we kind of move on to whatever the next project might be. This is absolutely about those transformational relationships. So I think it's a really exciting opportunity for us to really understand what system change means in some of our places in Lincolnshire. And I think the final point that I wanted to make was just a massive thanks to a lot of people in this room and people outside of the room for getting us to where we've got to. Sport England and other colleagues, external consultants that we're working on with this work, have been exceptionally impressed by the commitment of partners to get us to where we are today, and the commitment in Lincolnshire to work together. They're not seeing us, competing with each other. They're actually seeing Derek, John, Neil, all sorts of people come together and say, look, we're committed to doing this work. And actually, I'm really grateful that it's also come with a what do you need to help make this happen. It feels really positive. And I just wanted to bring the board up to speed with this piece of work, because we're going to quite quickly now see the investment start to flow and the work really start to ramp up in place. So happy to take any questions. Thank you.
Thank you, Emma. Any questions or comments from anyone? Jerry.
Thank you, Chair. Thanks very much, Emma. It's really exciting stuff, and I love the immersive nature of engaging with communities. I suppose it's a broader question of being conscious but ignorant of the fact that we're already doing lots of us in different agencies doing lots of place-based or neighbourhood-based working with communities. I'm just wondering the way in which this sort of slots in, rather than we all come and appear to come and go, and the community doesn't necessarily see the way it's all joining together. So perhaps that's a wider conversation than just yourself, but something about the way in which this work, immersive that it is, dovetails into existing health and wellbeing work that we might be doing in some of these communities. Thank you.
Yeah, absolutely. I'll come in, and perhaps John or Derek might want to chip in as well, but we are very aware of that, and this won't be physical activity coming into a place and doing its thing in isolation. The kind of work that we'll be doing will actually start with working out what else is going on in that place and how we can work with what's going on in that place, because I think that's the only way it's going to be sustainable. We're also very conscious that a number of communities have been consulted with, almost exhaustively around all sorts of different pots of money. So this is about adding value to existing community work in a place, not duplicating, not adding layers of complication, but actually kind of working out what's there already and how physical activity can be part of the conversations, whether it's mental health transformation, whether it's frailty, whether it's older adults, whether it's a housing strategy. All of those things would benefit from having a lens about actually let's thinking about how we're enabling people to live more active lives. So we are really determined to make sure that this isn't physical activity coming into a place, dropping something in, and then in 2028 disappearing again, if that gives you some reassurance.
Thank you, Emma. John, did you want to say any more on that particular piece?
I'm happy to at the end.
Okay, right. Michelle.
Thank you. Thanks, Emma. Obviously, really interesting stuff, and I'm sure we can share some of the data that we're doing as well. I just would like to understand whether there's an opportunity in those people that are in receipt of personal care through adult social care and other organisations across Lincolnshire, whether there's some way we can integrate a activity model through delivery of personal care. So I'm thinking around, chair-based exercise programs, and because a lot of the stuff that we talk about is for community, and those that can get to it can enjoy it and benefit from it greatly. And I just think there's always an opportunity, maybe, and I don't want to spend your money for you, Martin, but 5 minutes even of some chair-based activity on a regular basis could really improve and empower those individuals who are in receipt of home care, and whether there's something that can be discussed between Lincoln and yourselves with regards to that, and perhaps obviously adult social care services.
Emma, did you want to respond? Well, I know he's bursting, but he's in a queue. to Michelle, yes, of course.
So to Michelle's point, we already as a county council fund a pilot that we're hoping to mainstream around a balance and stability programme, which does include some aspects of chair-based programmes. It's quite an intensive programme based on some academic work that we've done around the FAME model, but it is very much about people, predominantly older adults who have had a fall or a high risk of fall, building their strength and balance, which is part of the broader physical activity agenda, which is obviously good in and of itself for them, but it also reduces the risk of a fall, which is obviously good. It also trains individuals in how to fall if you are going to fall. So there's a whole range of different things. That is really at the quite acute end, and it's an intensive long-term course, although a lot of the benefits are people connect with others who are doing those classes as well. And I think Michelle's point is sort of the more shorter, quicker, more readily deliverable at scale question, and I think that's a really good question. Coming back to the point, we've got to build it into everything we do, haven't we? That's the bottom line. Absolutely, we've got to engage with communities, but everybody who works in and for that community needs to know what's available in and for that community. And I think that's probably one of the quicker wins that we can deliver via Health and Wellbeing Board, the integrated care system, is everybody who works with and for us understanding the breadth and depth of the offer.
Thank you, Derek. Martin.
Yeah, if I can just build on what Derek has been saying and just really support the idea and the suggestion. I mean, it's really, we need to be working on multiple time frames at the same time. We need to be working on the basis of people at younger ages who are in pretty good physical shape. There's a real priority to enable people, to encourage people to be active and to maintain a good level of well-being, because that's a good thing for them now, but it'll make a huge difference to their lives in future. But equally, at the same time, there are people who are already in the care system, as Michelle has been indicating, people where it would be very easy to slip into the thought of, well, someone's in the care system and therefore, well, they can't really be physically active, and there's not much that can be done, and therefore, we should essentially be in a world of managed decline. And I think within the adult social care world, we're very much working against that kind of philosophy, because the point is that people can have a really good quality of life for an extended period of time, even if we've got adult social care, even if they're in the adult social care system. And that point, picking up what Derek was saying, that if people are able to maintain even a modicum of physical activity, even if they're in the care system, that makes their life a better life. It gives them a better quality of experience, which is in itself a good thing, but it does also mean that it pushes off into the distance the time when they'll need more care. So it's one of those classic areas where it's a huge benefit to the individual, but it's also a benefit to the public service, because if people are living an independent life, that they're in control of their life, then actually people in those situations don't need to call on services. So it's something we strongly want to encourage.
Thank you, Martin. John, did you want to sum up?
Thank you, Sue. Firstly, just say over the past few years, I think it's to Emma and Active Lincolnshire's credit, and it's on all of us in a good way, that Emma leads on physical activity for us as an integrated care system, and for us as the Health and Wellbeing Board. So I think that's really, really positive. We know, don't we, that physical activity rates, or is it inactivity rates, in some parts of Lincolnshire are amongst the worst anywhere in the country. Emma refers to this strategic group of leads that sort of I chair. That involves Derek, it involves Sunil, a wide range of partners, including Sports England as well. I'm really excited. I mean, I think this could give us a real sort of step change amount of support across Lincolnshire in the bid. And I think the success of our bid is a combination of clear population need that is we're all very familiar with, but also I think a bit of confidence in our collective ability to use this, what at the end of the day is taxpayers' money, to have best impact on the health of our population. And I think there's just something we've got together between us that's quite helpful in that regard. I'm sure as well, Emma, it'd be helpful if when we put the bid in, you're able to reflect the strong support of the Health and Wellbeing Board for the work. And just finally to note, slightly separate from this, but we are engaged with other partners at a national level about what an exemplar programme would look like for physical activity as well. Quite early days still with that, but maybe over the course of the next 6 months or so that may come through a bit. Thank you, Sue.
Thank you, John. Is there anything more that you wanted to add, Emma, or is that it? Okay, well, we'll make sure that nobody leaves the room without signing up to support your bid, but thank you. Okay, we move on to our final item, which is the Better Care Fund. And are you introducing Martin, or is Paul going to dive straight in?
I'll just say a couple of words before Paul dives in. So clearly, the BCF, a long-standing topic of our landscape, really important area that we've been working on for a number of years. One of the main ways in which government over a long period have sought to encourage the NHS and local authorities to work together. As always, we're in this slightly odd position where the national guidance in terms of deadlines for things to be submitted doesn't fit with the meetings of this board. So I think we are, as always, in a position where we've had to submit something which is now coming back to Health and Wellbeing Board for formal approval. So just before I ask Paul to take us through, just to note that a couple of things. We've been doing some reviews of the BCF in terms of looking at some of the services that are sat within it, both to consider about the shape of the BCF in Lincolnshire. There's a as you'll be aware, there is a sort of mandatory area that is required to be there, and there are some areas where we have scope as to what and how much we add in, and we've been looking to see what works best for Lincolnshire in terms of the scope of the BCF in those voluntary areas. And then those services, we've also been taking the opportunity to have a sort of collective eye as to how well they are being delivered. And that's giving us, I think, a range of deeper understandings of where we sit, which I think will put us in a much better position for the next BCF plan that we need to take forward. And I think just lastly to say on that point that I say the next BCF plan, the current arrangements, the plan takes us through until the end of the current financial year. Clearly there have been political developments at national level. We are waiting for ministers to sort of work their way through their action list of things that need to be addressed. Oddly enough, the BCF was not at the top of that list. I can't imagine why. But we are expecting that at some point over the next few months, there will be decisions made about, is the BCF going to carry on at all? And if so, what we've been deliberately trying to do with the work we've been doing, and Paul has been playing an important part in that, has been to try to get that clear understanding of what is it that is most appropriate and effective for Lincolnshire, and then we will seek to fit that into whatever the national guidance is. So rather than taking the national guidance and saying, well, how can we make this work for Lincolnshire, we're going to, the aim is that we start with a sense of this is what we want to do for Lincolnshire right now. Let's adapt the national guidance to make sure that we do what the national guidance requires, but we're ultimately doing what's most appropriate for Lincolnshire. But that's sort of looking forward. As I say, we haven't had received any guidance on that at all, because government simply hasn't got there. But we are in a position where Paul can provide us with an update on what's happened in Q1 of the year that we're in at the moment. Paul.
Thanks, Martin. So as Martin said, the first part of Q1, as you know, we're required to submit a quarterly return. This was submitted on the 29th of August. It was due to, I imagine, the changes in government, a very small report. And you'll notice there are only 7 areas that we're required to look at. This is only 7 out of the kind of 60 schemes that we're doing as part of the BCF. And all we required on this point was just to update our kind of quarterly spend as it was. So as Martin said, we still require that to be approved by the board. But I said that's already gone through. So that's the first part of that. As Martin said, we've also been doing and conducting the BCF review. Initially carried out to look at kind of the whole BCF review, but obviously realising the size of the BCF in Lincolnshire, That was then narrowed down to focus to looking at learning disability placements and intermediate care, and this work was then overseen by LCC and ICB Joint Commissioning and Oversight Group. This then looked at a variety of different things as part of that group, but was undertaken by a group of peers and not intended to be in-depth or kind of technical review of the service instead, and was actually looking at how we can add value and bring a constructive challenge to that. The reviewers were invited to a virtual session on 20th of June, and then we introduced the review and familiar themselves with the BCF structure, objectives and budget in preparation for that session. We started off then with learning disability placements, which was carried out on the 5th of July, and then a report was presented to JCOG on the 23rd of August, and which I believe was taken to the System Oversight Group earlier this month. As I said, the broad aim was to establish a shared understanding of the breadth and scope of the BCF in the context of learning disability placements, and then look at, I guess, what we can do to support that and move forward. So the review was delivered by our LCC service lead, Justin Hackney, and also the ICB service lead, Richard Eccles, and they looked at some emerging themes which came from that, which were around governance and assurance, the BCF budget and financial management, benchmarking, performance, quality and outcomes, and the capacity, demand and risk. And then within your report there are 11 key recommendations from that I won't go through each one of those so you can see those. The intermediate care one was held on the 30th of July. When this report was written, it was still, final report was still in development, which has now since been done, and there are kind of 9 key recommendations that have come off the back of that. But the intermediate care one was looking along the same sorts of lines, looking at the shared vision for intermediate care across Lincolnshire, again BCF budget and financial management, and benchmarking and performance, and some other areas. So in conclusion, really, for this report, we're asking you just to note the content of the update on the BCF review, but also to accept the Q1 24-25 return.
Thank you, Paul. Can you just advise, have you got a timeline for the intermediate report? As far as final report is still in development, any ideas? You did say that. Did you say this? That
has been written, yeah, and that was also taken to the System Oversight Group last week, I believe.
Okay, so, thank you. And then. No, that was all from me. Questions or comments from anyone, please? No, I think it. John?
Thank you, Sue. If I can just perhaps add for the record that the oversight group is jointly chaired by Debbie and I, and we met for the first time actually Monday last week. Now that has oversight of quite a considerable range of things that the NHS and the County Council are working on together. So we did consider the outcome of both of the reviews under the BCF frame. It's fair to say we had a full conversation about that. We asked if the work could be evolved going forward. Quite a few challenges, I think it's fair to say, that Debbie and I put to the work, and obviously that's now, Martin, going to be taken forward within that frame and in partnership through JCOG. So I think this is a helpful update, but just in terms of where we are today, there's more work that's been asked to be done as we move forward with this. Thank you.
Okay, thanks very much. Yes, sorry, I did then read. I was thinking, I got draft in my head, so I was wanting to know when the final one was done, but sorry about that. Okay, so everyone, can I just ask for your approval in retrospect for this review of the 24-25 planning, which has already gone in, as it always feels that it does. I suppose I must put on record that it is, I agree with Martin, that it is frustrating that we don't seem to have a time in which we can decide on it or sign it off before it actually goes in. I quite understand the reasons behind it, but it just doesn't feel quite right somehow, but accepting that there's not a lot that we can do about it. So are we all happy to agree this retrospectively? Thank you. Okay. Just two further, they're not papers, but agenda item 8A is just the decisions from previous meeting. Everybody happy with those? Yeah. And then the forward plan. And as always, if there is something that you would like to bring to the agenda, then please let Alison know and we'll make every effort to incorporate it. So thank you. If there are no more comments or questions, I will declare the meeting closed. Thank you for your attendance.